Okay, good afternoon, everyone. My name is Jasmine Chen. I am a radiologist, and my partner is Edel Roder. She is a system engineer. We are Uruguayan research. Sorry for my English, it's very difficult for me. We are currently researching about breast cancer and computational ontologies. Our work resulted in the creation of an ontology for mammography screening the recommendations. It is a sample ontology designed to provide mammography application recommendations for the detections of breast cancer in patients at average risk of contracting the disease. As we know, breast cancer is a major health problem worldwide. It is vitally necessary to have effective methods of early detections of the disease. Strong evidence has shown that mammography is a study great value to identify breast cancer in its earliest stages. This has led both medical research groups and health authorities to create different guidelines based on evidence with recommendations about when women should start mammography study and when what shall do it. Okay. Okay. This is the content of our presentations. I will talk about the motivation ontologies and the related work. Edel will tell you about the mammography ontology, work in progress, conclusions, and our future works. Okay, in order to make the necessary recommendations to the women at the time of the consultations, the doctor must determine through the medical history question for the woman or another source of information if the woman risk disease. Once determined, the doctor can provide recommendations. Our first ontology presents the knowledge about the recommendations. Okay. Okay. Thanks. Okay. Our first ontology represents the knowledge about the guides of recommendation for breast cancer in women that average risk created by the American Cancer Society. Many institutions have created guides of these types. We use the recommendations about of the ACS as a case and study. As you will see, our ontology can be extended or to created by the other organizations. Now I'm going to explain the recommendations of this guideline with a diagram. Okay. This guideline classifies as women within the average group with this guideline classifies this guideline classifies as women within the average risk group choose no history of prior radiation therapy to detect at a young age, 10 to 30 years, and no personal history of breast cancer, and no suspect or confirmed genetic mutation known to increase breast cancer risks. For example, the BRCA1 and BRCA2 mutations. If this woman meets all three of these conditions, the doctor can provide the recommendations about the recommendations in this guideline. These recommendations are classified according the level of evidence that supports them. In strong recommendations, there is the consensus that the benefit of adherence to these interventions outweigh the undesirable effects that may result from screening. And qualified recommendations, there is clear evidence of the benefits from screening, but less certainly about the balance of benefits and harms. This allows both the patients and the doctor to question the recommendations and make a decision together. These guys recommend these guys recommend depending on the age of the woman. Whether or not a mammogram should be performed and how often it should be performed. For those women between 40 and 44 years, the guides recommend performing a mammogram per year. This is a qualified recommendation. For those women between 45 and 54 years, the guides recommends to be performed a mammogram. This is a strong recommendations, and with a periodicity annual. This is a qualified recommendations. For those women older 55 years, it's recommended performing a mammogram per year with the options to performing it every 2 years. Both recommendations are qualified recommendations. Related work. Regarding previous work related to our article, we found some ontologies related to breast cancer. These first two articles talk about ontology that prioritize computational access to breast cancer knowledge in order to represent the information in a format in which computer system can process it. These two intake data from various cells, consolidating the information in a unified database. This article facilitates assertive communication between the doctor and the patients, harmonizing terminology and improving mutual understanding. The last articles, we find a work in which 6 ontologies are described: an ontology for patient, for breast cancer, for risk, for symptoms, for laboratory test, and for questionnaire. But we didn't find any of them accessible. Despite the background mentioned in our article, to the best of our knowledge, no open provides a recommendation for early detections mammography in women at average risk to developing the disease. Thanks.
As Jasmine said, the mammography screening recommendation ontology conceptualizes the American Cancer Society recommendations for women at average risk of contracting breast cancer, but by describing those attributes of women that are relevant for recommendations, as well as the recommendations themselves. The set of petitions in the ontology are used by the reasoner to entail the correct recommendation for each woman instance. In the implementation of the ontology, we reuse some terms of the National Cancer Institute thesaurus of the USA. As we see in the slide, there are three main classes: woman, recommendation, and history. Women with intermediate risk of contracting the disease are represented by the subclass, by the only subclass of women, anticipating that the ontology can be extended with other subclasses for other groups of women. And then within this class, the three subclasses represent the age ranges distinguished by the guideline with different recommendations. The class history is also modeled as a general class, even though we now focus on the subclass personal medical history that represent the clinical records of women. The property as history relates women to her record, and the property does not have history relates women to those diseases, clinical diagnosis, or test results that they do not have. If that's the case, it is very relevant that the ontology explicitly declares that a woman does not meet the three following conditions: to have a history of breast cancer, the confirmation of suspicion of genetic mutation that increases the risk of contracting the disease, and previous history of gender therapy at a young age. Finally, the class recommendation represents the set of recommendations provided by the guideline, and that are described by three different dimensions. The strength of the recommendation given by the class recommendation type, with instances as Jasmine said, qualified and strong, and the kind of mammography study represented by the class mammography, with the only instance screening mammography, and the periodicity of the mammography performance represented by the class periodicity with instances annual or weekly. And the property class recommendation relates woman to recommendation, and property has rectile, has mammography, and has periodicity relates the recommendation instances to each dimension. Regarding the most relevant restrictions in the ontology, in the upper part of the slide, we have a set of actions that the reasoner used to classify women at average risk of contracting the disease if they meet the three conditions previously mentioned, and also to classify them into the age range 40 to 44, 45 to 54, and greater or equal than 55. And at bottom, we have the set of actions that allow the reasoner to entail the correct recommendation for the women at average risk of contracting the disease, and within one of the three age range. as each recommendation provided by the guideline is described by 3 dimensions, we also define a property is recommended to entail a direct connection between each woman and the strength and the periodicity and the kind of mammogram. The property is recommended is a super-property of 3 property chains that compose the property recommendation with the corresponding properties to each dimension. These slides illustrate the property is recommended, the super-property, for the instance, woman 2, that is directly connected to instances qualified, annual or biannual, and screening mammography that corresponds to the recommendation greater or equal than 55. And in this slide at the bottom, we see the inferences for woman 2 in the implemented ontology. Yes. Well, now we are extending the ontology, the mammography screening recommendation of ontology, to consider women with high risk of contracting the disease. Women are evaluated with a high or medium risk level by applying different risk evaluation models, such as the closed model or the direct sick model. These models consider different risk factors of women, such as the age or other factors such as genetic, hormonal, or family factors. Women in this extended ontology, we want our ontology can conceptualize all these evaluation models with these risk factors. Moreover, besides the American Cancer Society recommendation guideline, there exist other guidelines such as the Canadian or the Uruguayan that have their own recommendations, both for medium or high risk levels. Then we want our ontology represent the different recommendation guidelines for the different risk levels. Now we have a first version of the extended ontology that will allow the doctors to obtain different recommendations provided by different guidelines. In this extended ontology, women will be classified by the application of different evaluation models into the corresponding risk levels. It's important consider to have in mind that the same woman could be classified into different risk levels by different evaluation models. For example, into a high risk by the closed model and into a medium risk by the direct to sick model. In this way, the doctor will have all this information available to decide the most appropriate recommendation for the patient. Moreover, we are starting to implement an application that will use the extended ontology and will have the usability required to the doctor can visualize all this information through a friendly interface. The idea is that the doctor enters the data of women that are not present in the history record, clinical records, that will populate the ontology together with the clinical records. And then first, the risk evaluation models will be applied to classify the woman into corresponding risk level, and then the reasoner is run to entail the correct recommendation for the woman, that all the recommendations for the woman, for all models, and for all recommendation guidance. Well, some conclusions of other works. We implement a first version of the mammography screening ontology recommendation that provides personalized recommendation for the early detection of breast cancer in women at average risk of contracting the disease. We take the American Cancer Society guideline that is based on the age range of women, and that define, based on the age, define the strength and the frequency of the screening mammography performance. The ontology appears as a promising tool for doctor-patient communication and also for training of this service professionals. And also it allows the medical professional quick access to the guideline recommendations in a non-verbose presentation. From the point of view of the quality attribute of ontology maintainability, our ontology has a simple design that can be extended and reused. As a feature work, we plan to validate the extended ontology that considers all models and all recommendation guidelines, and also to validate the application that uses this ontology by doctors of different health institutions. Moreover, we plan to extend the solution to other types of cancer and other diseases.